Hi, my name is Hal Berger, and I'm on the government relations team that leads our veterans efforts at Zero Prostate Cancer. I work closely with our Veterans Advisory Board on programming that benefits the veteran community. Joining me today are Shane Liermann and Marquis Barefield from Disabled American Veterans, as well as Erin Bradshaw, who operates the 0360 program at the Patient Advocate Foundation. First, we will hear from Erin, who will talk to us about how 0360 can help you navigate your prostate cancer treatment. Then we will hear from Shane and Marquis, who will tap into their literal decades of experience to talk to us about the VA benefit system and some of the issues that you might encounter as prostate cancer patients and survivors, such as proposed reductions to your VA disability ratings. Finally, we will have a Q&A period where you'll be able to ask our guests any questions you may have. But first, I want to give the mic over to Tom Uberti, who is a member of our Veterans Advisory Board, for a few words.
Hi, I'm Tom Huberti. I'm a Vietnam veteran, prostate cancer survivor. I served in the U.S. Navy on a Vietnam cruise, 1972-73, during which I was exposed to Agent Orange herbicide. I was diagnosed with prostate cancer in 2005. It's been a very long journey going through surgery, 37 radiation treatments, and hormone therapy. After my cancer metastasized into my liver in 2018, I also had to go through 7 rounds of chemotherapy. Thankfully, now my PSA, just checked last week with my oncologist, is at 0.05, which is almost undetectable. I still live with the effects of my cancer and treatment, such as increased urine leakage and unpredictable digestive and intestinal distress, which has caused me some very embarrassing moments. My treatment has also resulted in heart disease, for which I required surgery 2 years ago, having a triple bypass. As veterans, we struggle with many of the same issues as our fellow prostate cancer patients and survivors, but we also face some unique challenges. Prostate cancer is a presumptive condition from Agent Orange and burn pits of the Iraq and Afghanistan conflicts. The Veterans Administration hospitals are becoming ever more aware of and helpful for treatment to respond to the PAC Act legislation. But you have to make your first move. Go to your nearest VA and get registered into the VA system if you haven't already. After going through the medical exams and the service board service record checks, you may be qualified for a service-connected disability rating and a monthly tax-free payment of benefits, and your meds, your prescriptions filled by a VA pharmacy. A diagnosis of metastatic prostate cancer at stage 4 is likely to result in 100% service-connected disability rating, and that can be temporary if you go into remission. If the VA decides to dial back on your benefits, which is what happened to me, you can appeal. But I also recommend using a service organization like the American Legion, Disabled American Veterans, or the VFW. I hope at the end of this webinar, you will know what resources you can rely upon to get help you need to navigate your prostate cancer journey. Thank you very much for the opportunity to talk today, Hal. And Allie, thank you for all your leadership relative to government services and advocacy for people with prostate cancer, particularly veterans.
Good afternoon, everyone. My name is Erin Bradshaw. I am the Chief of Mission Delivery for Patient Advocate Foundation. Today, I'm going to be talking about the 0360 Comprehensive Patient Support Program and how we've been partnered with Zero prostate cancer since 2016. Our organization is a national nonprofit. We've been helping patients for over 26 years navigate the challenges that they face when they're diagnosed with a serious health condition like prostate cancer, with the practical barriers that they're facing. So I'm going to talk about some eligibility guidelines as well as what we can do for you and some of the things that we can't. We have some great partners on the presentation today that actually cover a lot of those aspects that are really specialized to their area. So we have very little requirements, actually. What we must have is a qualified, confirmed diagnosis of prostate cancer, be in active treatment for the health condition. That includes active surveillance or follow-up. be a U.S. citizen or a permanent resident of the U.S. and be receiving treatment in the United States or a territory, and then have a need associated to the services that we offer. Really, what we have come to know is that when you're diagnosed with prostate cancer or any disease, there are so many different barriers and roadblocks that can present. That can be anything from an employment situation and the protections that you carry, and many of the benefits that you might have as well if you're still working or if a spouse or significant other is. Insurance access, maybe the lack of or adequate, or maybe those high out-of-pocket costs that can lead to medical debt and your ability to pay, as well as their daily cost of living needs and some of those added extra costs associated to your needs to get to and receive treatment, such as transportation and lodging. And then all of those things really wrap up into these very emotional, distressing moments where you're trying to figure out how to balance your needs and what you've already had prior to the diagnosis. So our services are about helping you understand your health insurance coverage options, addressing problems that you run into with your coverage, and connecting you with resources that may help with some financial challenges that you have with paying for care and household expenses. So in the next following slides, I'm going to be talking about how we do that. And these are just some bullets here that share what it is that we do in more detail. It's about accessing that prescribed healthcare and understanding how to use your benefits to the best of their ability, as well as when you come up to an issue when you're being denied, or you have some financial concerns that prohibit your ability to get the treatment, or you have out-of-pocket cost. And we also help with applications for Social Security disability, as well as short-term and long-term or state disability, if that's in your state, as well as investigating some options if you are looking to during open enrollment or health insurance. So when we talk about reducing financial burden, our case managers are there to really understand your specific scenarios. Being a veteran is one, and how do we look at those and eligibility that you might have towards local, regional, national programs that offer some assistance, like transportation or housing or food or utilities. We'll also explore programs that assist with out-of-pocket medical costs or charitable copay programs, manufacturer patient assistance, and charity care that may be offered at the treatment facilities, and then work with you to resolve some of those unpaid medical debt that you might need to see if they're a discount option or a write-off, or even maybe negotiating affordable payment plans. When we are talking about screening for appropriate insurance, work benefits, and social programs, that is very comprehensive and expands things out to your entitlement benefits, Medicare, Medicaid, Social Security, whether you have enough work credits or not. So that's a supplemental security or Social Security disability, and then other insurance products that we might be able to consider, like Marketplace, or making sure you can tap into your veteran benefits, and then other critical education around what any kind of protections that you might be covered by if you're working, as well as all of the benefits they carry, and as well as finding those financial resources that can help with those out-of-pocket costs. I know that not all veteran treatment is at no cost, and sometimes there are some out-of-pocket expenses associated to it, as well as if you're maybe not being treated at the VA or one of the community organizations. So copays, premiums, deductibles, and out-of-pocket expenses. And one of our areas of expertise and specialty is really around health insurance navigation. It's using the benefits to the way that they're written, so your plan language and the eligibility guidelines behind them, but helping and support with things like prior authorization challenges. We can't submit the authorization, but we certainly can help with the administrative aspect and follow through and any other details along with your prescribing doctor, if that's something that's become a problem. Help with insurance appeals of all levels. So that can be from the very infancy all the way through external or an administrative law judge, and assisting with any kind of coding and billing challenges or payment structure that doesn't seem quite right. We do look at clinical trial screenings and enrollment assistance when asked, and we also help review your benefit design to understand any kind of second opinions or network providers and facilities. What we can't do is offer specific referrals, but we certainly can look at what coverage you have and if there are opportunities to maybe contest for expanded network if you don't have the necessary treatment or care provider within. And then we always can link to emotional groups. I know Zero has a wonderful peer group. We also can look at your benefit coverage around understanding any mental health benefits and those elements if needed. So there's a few areas that we don't provide assistance with, and they are very simply just we must be a U.S. lawful citizen and receive treatment in the U.S., which I mentioned earlier. Patient Advocate Foundation case management through the 0360 program. We do not have direct financial assistance. We're all about helping tap into the resources that are available and screening against them and helping you apply. And then if you have legal representation, or an accident or work-related injury, unfortunately, those aren't areas that we can assist. And specifically within the VA benefit eligibility and rating, we're not certified and able to address those, but our next presenters are going to be talking about that. And then providing any kind of disputes or advice for medical. There are patient advocates within the hospitals and the VA centers. They're best equipped to address those types of things. And we can help with health insurance benefit disputes and care as long as it's being supported by a treating physician. And there are a couple areas simply based on the lack of coverage and availability. That is not a statement of our position, but we are not able to provide support around medical marijuana or CBD or holistic medicine and treatment at this time. So I actually pulled some data, and I found this really fascinating because I wanted to understand the veteran audience from the global audience of those that we're serving through the 0360 program. And, to my surprise, 17% of the patients that had come to us this past year in a 12-month period were veterans. And so we know that there's a secondary option as well to kind of check in and look at those benefits and what we might be able to explore above and beyond some of the resources that we have. We also help people overcome and find recovery around fees, whether that was finding some assistance through charitable programs or enrolling into free drug programs or helping locate transportation aid, all different varieties that could come there of over $514,000. And that's an average of around just under 2,000 a veteran during this 12-month period. And you can see that the top 5 issues are very reflective of financial and that impact to being able to sustain the household and with housing and utilities, but also the need for transportation to get to and from treatment and the copay assistance around medications. Spiked as the highest issues reported by patients we served this past year that were veterans. So I did review some cases, and I wanted to provide a case study for you to talk a little bit more about what all of those, what we can do means. And this particular gentleman, he was an African-American male in his 70s. He came to us insured. He was diagnosed with prostate cancer, and he needed some help with transportation. When our case manager was involved and started to do a needs assessment, we uncovered that he had late-stage prostate cancer, and he was just starting to have chemotherapy at a facility that was more than 30 miles round trip for him. Fortunately, due to his location, this was the closest facility for him. But we uncovered that he also had some insurance with some medical bills, and he needed to address some of the issues that he was being forced to pay upfront on medications, which were very challenging for him. So between the added cost of transportation and also this unexpected budget item of paying for medication up front before reimbursed, he was really having a difficult time. So we conducted some research, educated the patient on some things we found. We got some direct referrals to a copay program and helped identify 3 other national and 1 local resource to address some of the transportation challenges he's having, and another one to offset some of those non-medical costs. So with food and rent and thinking about the travel, there's going to probably be some more support around likely like maybe to go food items and things of that nature. And we also addressed an application issue that he had with a stalled app. When we were doing the copay program, there was a stall within that application, and we were able to engage with the office and work through that so that we could get that necessary information and get access to the medication that he needed. I'm so pleased to have testimonials and for people to share, but mostly why I wanted to pull this was to just show you how the work that we do with an appeal, it really is about understanding the benefit, understanding why it was denied, and creating that really strong crafting response as stated in this quote. We helped her carefully craft responses and gather all the necessary documents, and something that he did not feel that he was equipped to do when he started the process himself. And with all of our help, and engagement, we were actually able to overcome the denial, which happened to be a procedure for his prostate cancer, which they claim was not covered. And so we just got all of that together and overturned that for Roy. So I want to thank you all for joining today and let me share more about our program and how we might be able to help you. Contact information is located here. You also can find access to an online request at zerocancer.org/0360. And really do encourage you, if you know someone or you are needing some help, we're here to try to help alleviate some of those stresses for you. Thank you.
I'm Shane Liermann, DAV Deputy National Legislative Director, and with me today is Marquis Barefield, our DAV Assistant National Service or Legislative Director. Between the two of us, Marquis and I have been representing our fellow disabled veterans within the VA system for a combined of 50 years. We have a lot of experience in dealing with how VA evaluates prostate cancer claims and how the process should work. We're going to jump into that. DAV has been today's agenda. We're going to talk a little bit about DAV's history and an intro. Then we're going to go over VA ratings for cancer, the proposed reductions, and VA ratings on residuals of prostate cancer. So the best way to explain this, and the easiest way really, is when it comes to cancer ratings within the VA system, all ratings for cancer will be a 100% rating if the cancer is considered active. Usually, VA will set up a routine examination to reevaluate the cancer rating in the future as they determine it will not be permanently active. So when they're looking at your case, if they determine that your cancer may improve, that's when they would set up a routine future exam. So when we're talking about prostate cancer, real quick, I just wanted to throw out there that not only is prostate cancer a presumptive disease for Agent Orange exposure, veterans exposed to Agent Orange, whether in Vietnam or the new locations they recently added, but prostate cancer is now considered a presumptive disease. In other words, an automatic condition for those that fall under the PACT Act that were exposed to burn pits. And we can talk about both of those toward the end of the webinar. So if you're 100% for your cancer because it's active, they may require to look at you in the future. Once it is determined that the prostate cancer is not active or it is considered in remission, VA will make a proposed rating decision. So what this means is if your overall combined rating would change and reduce the amount of compensation you would have, VA must make a proposed reduction. Let's say you're 100% for prostate cancer and you have other disabilities, but you're getting paid at 100%. If they are going to reduce the cancer rating for the prostate cancer, reduce the rating because it's no longer active, it would change your overall compensation amount. So they must do a proposed reduction. Important things to remember. The proposed reduction will indicate the level it'll be reduced to, or they're proposing to reduce it to. And this will be based on the residuals of the prostate cancer. It can be reduced from 100% to 60 to 40 to 20 to 10, or even 0%. But again, this must be based on the residuals of the prostate cancer. A proposed reduction is not a final action. And I really want to enhance that and talk about this as much as we can. If you get a rating decision from the VA saying they're proposing to reduce your cancer, this is not a final action, which means they will make a final action to either implement the proposal or not. But most importantly, since the proposed reduction is not a final decision, essentially, you cannot appeal. I'll say that again. You cannot appeal a proposed reduction because it's not a final action. Marquis and I have experienced this over the years a lot. Veterans will try to appeal a proposed reduction. You cannot appeal it, but we will tell you exactly what you can do. So if you get it, there are two essentially different actions you can take. So if they propose to reduce your prostate cancer from 100 to 40, we can't appeal the proposal, but we can do two things. One, we can request a predetermination hearing within 30 days of the notice of the proposed reduction. Or two, we can submit additional evidence within 60 days. That 60 days is very important. They have to wait that full 60 days to give you due process to submit any additional evidence if you don't request a predetermination hearing. Now, predetermination hearings, I'm a nerd, so I threw up the regulations there for you to look at. 38 CFR 3.105I, this has to do with proposed reductions. If the hearing request was received by VA within 30 days from the date of the notice, VA cannot take any final actions until after the hearing is held. If a predetermination hearing is timely requested, benefit payments shall be continued at the previously established level, pending a final determination concerning the proposed action. So in other words, what does this all mean? If they propose to reduce you from 100 to 40, you request a predetermination hearing within that 30-day window, they cannot reduce you until the outcome of that hearing. So, excuse me. So we're talking potentially 90, 120 days. And since they can't reduce you, you will still be receiving and entitled to receive the 100% rating for the prostate cancer. So it will be continued while they make a decision on the proposed reduction. So VA, in their letters to you, likes to advertise to all veterans in proposed reductions that this proposed reduction or final reduction could result in an overpayment. However, I really want to stress that is not true. It is not true. It is not true. A proposed reduction or a final reduction will not result in an overpayment to the VA. And that's because VA cannot reduce benefits until 60 days after the last day of the month once a final decision is made. So what does all that mean? Let's say we request a hearing within 30 days. 3 months later, you have the hearing. 3 months after that, they make a decision. The day they send you the decision, they can't reduce it until 60 days after the date they notified to reduce you. So in other words, a proposed reduction or a final reduction cannot create an overpayment, unlike what VA will tell you. And the reason I want to make sure you understand this is a lot of veterans will, at some point, tell the VA to go ahead and reduce them so they don't have an overpayment. Don't do that. A proposed reduction or final reduction will not result in an overpayment by the VA. The predetermination hearing will be held once you request it within 30 days by a VA rating specialist who did not participate in the decision to propose to reduce you. In general, as I was saying before, it can take 60 days to get a hearing, 60 to 90 days to get a decision after the hearing. So by requesting that predetermination hearing within 30 days, you're giving yourself essentially 4 to 6 months before they're going to reduce you if they decide to make a final reduction. But what you're really doing is giving yourself a fighting chance to fight against the proposed reduction. So they will notify you at the last address of record for the proposed action, and you'll be given 60 days for the presentation of additional evidence. So if you decide not to request that predetermination hearing within 30 days, you have 60 days, as we said, to submit additional evidence. If you do nothing after that 60 days is up, they'll make a final decision to reduce your prostate cancer. So after the 60 days expire, if nothing is done, they will make a decision. Now, once the cancer is proposed to be reduced, as we noted, it will be reduced to a percentage based on the residuals of the prostate cancer. So now we're going to talk about VA ratings on the residuals of prostate cancer. So if you're active cancer, you're going to be 100%, as we talked about, but now they're going to rate you on the residuals, and there's 3 different ways in general they will rate the residuals of prostate cancer. One is voiding dysfunction. And if you take a look, you can see up there where there's a 60, a 40, and a 20. This is the most common way they rate the residuals of prostate cancer based on voiding dysfunction. And as you can see, it's really geared toward how many times a day do you have to change absorbent materials. So even though they do a proposed reduction, you request a predetermination hearing, what we can do is argue for a higher rating than what they are proposing to. So if we know the cancer is not active and they're proposing to reduce you to 20, we can try to argue at the hearing that it should be a 40 based on the number of times you change absorbent materials if it's rated on voiding dysfunction. Another common diagnostic criteria they use is urinary frequency, and that's based on the number of times that you're voiding. I've argued several cases like this over the years where a veteran may awake to void more than 5 times in a night. I've had several veterans only change absorbent materials maybe twice a day, but they're getting up to go to the restroom 6 or 7 times in the middle of the night, which would get us a 40% under urinary frequency. Now, another way they evaluate it is obstructed voiding. And this has to do with very unpleasant things, like if your urinary retention is going to require catheterization. And so they will base it on those criteria there. Now, normally, we don't see this rating criteria used a lot on the residuals of prostate cancer. What we normally see, as I pointed out, is the one on voiding dysfunction and urinary frequency. A predetermination hearing, as I said, this is where we can argue to have a higher rating based on the residuals other than what they're proposing. Now, additionally, I want to make sure everybody gets this, and that is VA does not consider elevated PSAs as evidence of active cancer, nor can elevated PSAs be used to determine the residual. So even though your doctor, your oncologist may be telling you that your PSA levels have increased after they did the surgery or removed the cancer or a radical prostatectomy, that in itself, in VA's mind, does not fit the definition of an active cancer. If a final reduction is made, so let's say they propose to reduce you from 100 to 40, and they decide to reduce you after they went through all the steps, they're going to reduce you to 40%. Once you get that final reduction decision, then you can appeal it. But once you appeal it at that point, once that decision is made, your compensation will be reduced to that percentage until the outcome of the appeal is overturned. So if you can get it overturned on appeal, at that point, they'll reinstate levels of compensation. But if you don't request a predetermination hearing, or if you do and they make the final reduction, once they make that final reduction decision, they will reduce your compensation. And even though you can appeal it, they still will reduce your compensation until the outcome of the appeal has been decided. Something else to mention that many of you may already be aware of if you're service connected through the VA for prostate cancer, there's something called Special Monthly Compensation, or SMC. It's known as the K Award, and it is granted for loss of use of a creative organ. In other words, for our purposes, erectile dysfunction. So the VA can give you a 0% for erectile dysfunction secondary to the prostate cancer, but they will give you the SMC award or the K award, which pays you additional amounts of compensation on top of what you're already receiving. This is very common when there is a radical prostatectomy. If you had a radical prostatectomy, it's very common to have erectile dysfunction and then be awarded SMC, which we know as Special Monthly Compensation, the K Award. So to recap real quick, all cancers within the VA system are 100% when active. When they're not active, they'll propose to reduce it. Remember, you cannot appeal a proposed action, but requesting a predetermination hearing within 30 days protects you. They cannot reduce you until the final outcome after the hearing's been held. VA will propose to reduce based on the residuals and those different diagnostic criteria that we just talked about. And you can argue for a higher evaluation at the predetermination hearing. And that is something we've done a lot over the years, is it may be proposing to reduce from 100 to 0. And at the hearing, we'll argue, no, it should be 40 or it should be 60. So remember, you can still fight the percentage they give you at the predetermination hearing. There are essentially three main types of residuals that are rated by the VA. We talked about those. Two are the most common. The first two, voiding dysfunction and urinary frequency. When there's a final decision, you can appeal it. And don't forget, the SMC award is granted for loss or loss of use of a creative organ and is paid additional amounts of compensation on top of what you're already receiving. So if you need assistance, that first website there will take you to DAV's website, where you type in your zip code, and it'll give you the DAV National Service Office, our professionally trained benefits advocates in your location. So DAV is co-located where the VA regional offices are. So we have direct access to all your information and can represent you at that level. If you have any additional questions or need some assistance, you can always feel free to reach out to me, Shane Liermann, sliermann@dav.org, or my colleague here, Marquis Barefield, at mbarefield@dav.org.
So our first question is, I do not consider myself disabled. Why would I apply? My medical experience is improving with treatment.
Now, disability is all a state of mind. I'm a disabled wartime veteran, so is Marquis. Everybody's disabilities are different. Now, you don't have to believe you're disabled to be qualified for VA disability compensation. If you have a disease related to your military service, you can receive not only compensation, but free health care from the VA for any condition that's service connected for the rest of your life. That includes medications, prosthetics, anything that comes with it. Plus, there are so many other ancillary benefits, to include additional education benefits, to include additional benefits for the number of dependents you have. So there are extreme advantages of using the VA system. Whether you consider yourself disabled or not, you can receive that monthly compensation and get free health care for any service-connected condition for the rest of your life.
To my knowledge, I was never in an area where there was like an Agent Orange during my time in the Navy. Should I even bother applying for disability?
Well, I think you should talk to somebody before you make the decision whether or not to apply about specific. A few years ago, DAV was able to advocate to get what we refer to as Blue Water Navy. So there are certain locations off the coast of Vietnam that are considered to have been exposed to Agent Orange. Also, as part of the PACT Act, they added new countries that they're considering to have used Agent Orange, and that includes Thailand, Laos, Cambodia, America Samoa, Guam, and Johnston Atoll. So there are some other locations they've just added that you would automatically be considered exposed to if you were at any of those locations.
On which government websites do you find your current with disability only benefits?
Well, you can go to va.gov and apply there. However, doing this as long as I have, I really encourage you to do this with the assistance of a VA accredited representative, because they're going to help guide you in the right directions and provide certain information that you may not be aware of. So whether it's DAV, VFW, American Legion, Vietnam Veterans of America, I would use an organization that understands this so they can help you so you don't make any mistakes or unintentionally cheat yourself out of some type of entitlement.
So Charles asks, I have had my prostate removed. I completed 30 radiation treatments and completed hormone therapy. I am at a 0.04 PSA. I did not file for disability. Can I now?
Yes, there is no time limit to file a claim for VA disability benefits. So If you were exposed to Agent Orange or part of the PACT Act and you now have prostate cancer, you can definitely file the claim. Now they're going to rate it on your current residuals if it's not an active cancer, and it'll be effective the day you file the claim. So it won't be retroactively applied. We help World War II veterans establish claims, and Korea veterans to this day get benefits. So it's never too late to apply, but remember, it will be based on what your current residuals are, and it wouldn't include any of the surgeries or the PSA. It would include the residuals of what we discussed of avoiding dysfunction or urinary frequency.
When I got my rating, it did not cite any percentage or additional compensation for the K award. After several months, I got a reduction letter, a proposed reduction letter. And I since provided more information. The reduction is from 100% to 40%. I visited my urologist earlier this month or late last month, and heart disease is also considered a presumptive condition related to Agent Orange exposure. The treatment I had for prostate cancer in 2006 included ADT. ADT reduces the testosterone levels, and there is a connection perhaps between the reduced testosterone and triple bypass that I received a couple of years ago. Should I contact you and see what I need to do for the decision? I got one of those we've made a decision letters, reducing it to a final 40% based on the number of absorbent materials used daily, but I still have other issues. So I probably should just contact you.
Well, I think that's probably the best, so we're not sharing all of your sort of details with me, you, and several hundred of your friends here online. But I want to make one point real quick that everybody hears. We do not need to try to relate your heart condition to the prostate cancer, and here's why. As you noted, Agent Orange has over 20 different diseases that are considered presumptive or related, and ischemic heart disease is one of them. So if you have a heart condition, we can try to relate that to your Agent Orange exposure and not have to try to tie it back into the prostate cancer or any of the other conditions or treatments, because it is a recognized disease related to Agent Orange.
Is exposure to jet fuel recognized as a cause? I worked on the flight line of fueling jets in the Navy. I read the Pentagon recently recognized that flight crew and pilots have a 16% increase in prostate cancer than the general population.
Serving on a ship and exposed to jet fuel, no. Jet fuel is not considered a toxic exposure to cause prostate cancer. Not yet. There are a lot of toxic exposures as part of the legislative team Marquis and I work on, but that's not one of them. My next questions to you would be, where were you? When did you serve? What locations were you at? Because they did just add this as part of the PACT Act. And this goes back to the first start of the Persian Gulf War. So if we can place you in any of those locations from 1990 till forward, there's a chance we could get the prostate cancer related as exposure to burn pits and other airborne hazards instead of trying to go that route. So my best advice, talk to somebody like me to make sure you just don't do it. Make sure you know exactly what we can do, because there might be an option for you to get it granted.
Okay, if I have active prostate cancer and am undergoing hormone therapy which results in erectile dysfunction, will my compensation be over 100%?
Based on just that, yes and no. And let me clarify. If it's an active cancer, it's automatically going to be 100%. Now, erectile dysfunction is 0% in the VA, but they pay you an additional amount of compensation for the K award. So theoretically, yours is going to be like $100 more than 100%. But that brings up another thing. There are other types of special monthly compensation where, as a veteran, you can be rated much higher than 100%. That's a whole nother bag of chicken feed that Marquis and I can open at another date. I won't get into that now because that'll just confuse myself even more.
Only prostate cancer that is service-connected qualifies, correct?
Prostate cancer is a presumptive disease to Agent Orange and to PACT Act, but there are multiple other types of cancers that can be considered as presumptive diseases to exposures. So I'm not quite sure what you're asking, but there are more conditions out there than just prostate cancer.
No, I think he's asking if you have prostate cancer that is not connected to, your service, would it be covered?
No, if you have prostate cancer that we can't prove is related to your military service, it would not be considered service connection. So there would be no compensation nor any health care specific to that condition.
So Dave asks, I'm currently treated for stage 4. A urinary function is okay. I'm not currently treated at VA, but I do have 100% a service connection to VA. Do I need VA treatment so I'm not losing 100%?
No, VA treatment is your right once a condition is service connected. It is not a requirement to maintain any percentages. Not every veteran who gets a disability uses VA healthcare. The advantage is it's free. So using private healthcare or other healthcare is not going to have a negative impact on your disability rating at all.
Once an application is submitted, how long does it take for a decision to be made for VA benefits?
Right now, VA is touting 125 days is the average, roughly. So we're talking 4 months. However, due to the PACT Act that just passed, they are tipping near 400,000 claims that are backlogged and a total of 800,000 claims pending. So my guess is it's going to take on the average 4 to 6 months to get a decision from the time you file the claim until you get a decision. But I want to bring one more thing up real quick. There's something called an intent to file. So let's say, based on what you heard today, you're like, wow, I should file a claim, but I don't have all my information. We should file what they refer to as an intent to file. That means you're going to file a claim. You have 12 months to file the formal claim. So if they grant you benefits, they'll go back to the date of your intent to file. So you should keep that in mind as potentially protecting effective dates for yourself if you're not going to file the claim right now.
I applied for VA benefits a couple of years ago. I was assigned to VA Priority Group 8G. Now, having been treated for prostate cancer, am I eligible to apply for any of these benefits you mentioned today?
If you applied for VA benefits previously and you said category group or priority group, that's a treatment group at the VA Medical Center. That does not denote that it's a service-connected condition. But if you haven't filed a claim for the prostate cancer yet, I strongly urge you to, because 1, you have the potential for compensation, and 2, it will change your priority group at the VA, your treatment group. So if you're currently in an 8, if it's a service-connected condition, it's going to be at least priority group 6 or higher. And what does all that mean? It means you get priority care for anything that's a service-connected disability.
Can your rating be reversed if the cancer reappears?
At any time throughout the process of having a disability, you can file a claim for increase. So if the condition's gotten worse, you can file a claim for increase. So let's say, for example, you were reduced to 20%, but now your symptoms and residuals are worse. You could file a claim for increase to have it rated at 40 or 60. Or if the cancer comes back and it's active again, you file the claim for increase based on the active cancer. And based on the results of either a VA exam or the medical documentation, yes, they can increase your rating and restore the 100% if the cancer is back.
I am a Cold War vet. I only have VA benefit of the rating of 10%. My treatment was all done by the VA, a surgery followed by radiation. I tried to see how to connect burn pit exposure in 76. We burned excess of gunpowder from artillery rounds, and we also used diesel heaters that vented exhaust issues. Any suggestions? I do not qualify for the PACT Act, but I do have an appointment with the toxic exposures group.
My advice is either you can reach out to us or reach out to a service officer, because there might be more information in another way to get it established. Marquis and I both believe there is more than one way to do this. I truly believe I can get anything service connected if I have all of the factual information.
You stated that a PSA is not used by the VA to indicate if prostate cancer is still active. What parameters do the VA use to indicate that the prostate cancer is currently active?
The oncologist says that your cancer is active. We need medical record evidence showing the cancer has returned and it's active. PSA levels, while they may be indicative of an ongoing problem or a symptom, it doesn't mean that your cancer is active. So in order to establish it's active, we would need something from the oncologist stating so.
We do have one question about if you have surgery after prostate cancer and you have permanent scarring from that, can this be a residual?
Yes. Scars are separately evaluated and rated conditions within the VA. A lot of times it may be a 0% evaluation for that scar, but if it's unstable or painful scarring, that can be rated at 10% or higher. Really depends on the severity of the scar itself, but you can be rated separately for a scar, absolutely.
My next question is from Juan. If I served in South Korea in 1990, could I possibly be eligible? My cancer is currently not active.
That is not considered a presumptive location for exposure to Agent Orange or to the PACT Act. The PACT Act would include the Persian Gulf War, and it would include those areas in Southwest Asia. I would try to list them all off the top of my head, but I'm a Marine and I'm from Nebraska. So let's just say intelligence and geography don't go well with me.
The VA treats me well with PTSD and the prostatectomy. Should I bother to look into the PACT Act?
If you're already getting benefits for those conditions, there's probably no reason to look into the PACT Act. But if you have additional disabilities or conditions, then you may want to consider if some of those could be related to other exposures to include in the PACT Act.
Is there any statute of limitations for a spouse to file a DIC claim for her husband that died from prostate cancer that was presumptive?
There's no statute of limitations to file that claim, but there are a few other. Anyway, there are a lot of different rules we could talk about, but I don't want to take up a lot of time. But no, there's no statute of limitations. You should file the claim.
To close, I want to once again say thank you to our guests for speaking with us today about this important topic. I'd like to also thank those who support our veterans activities at AstraZeneca, Blue Earth Diagnostics, Lantheus, Myovin Sciences, and Merck. If you have any questions about veterans and prostate cancer, please email veterans@zerocancer.org. Thank you so much.